Hi guys, so today I want to talk about shock. 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 Don't mind my hair, it's a bit tacky. Okay, so shock is a medical emergency that results from the insufficient supply of blood throughout the body. Yeah, it's like the body has a low supply of blood, and there are so many causes of this shock. It can range it can be from a disease or from an accident. Yes, so we have different types of shock. We have cardiogenic shock, hypovolemic shock, anaphylactic shock, neurogenic shock. Cardiogenic shock, as we all know, cardio, heart. So cardiogenic shock. Cardiogenic shock is when the heart is damaged and unable to supply sufficient blood throughout the whole body, and this can lead to myocardial infarction, which is also commonly known as heart attack, and it can also lead to congestive heart failure. We also have hypovolemic shock, which is as a result of hypo means low, volemic is volume, so low volume of blood supply throughout the whole body. It can be because of an injury, yes, or low blood shortage. Yes, you have a low blood from your injury, bleeding to excessive bleeding. It can also cause it, which can also make the heart unable to supply that blood at that moment because of the shock. Neurogenic shock, which is as a result of the spinal cord injury, maybe from an accident. You now have an injury in your spinal cord. This can also lead to shock. Then anaphylactic shock is due to hypersensitivity or allergies from food, insect bites. We also have septic shock, which is as a result of infection. Yes, that is the one where the infection multiplies in the bloodstream and releases harmful toxins to the blood system. Example of such might be skin infection, ruptured appendix, urinary tract infection, pneumonia. These types of shock we've now seen that we have shock resulting from infection, resulting from low blood supply, resulting from the heart's inability to pump blood sufficiently, and resulting from trauma, from accident or any injury. Now let's look at the symptoms of shock. How do we identify a patient who is in a state of shock? Yes, I should put it that way. So then, shock. When someone is in a state of shock, you notice that the person has a confused state, like it's just blank, he doesn't know what is happening surrounding. His eye can just be wide open and just staring, and you'll be asking hello sir, and he's not responsive. Okay, we also have the clammy skin, where the body will be cold and wet, and you feel when something is wrong. We also have dizziness. Some people experience dizziness when they're in a state of shock, while other people have difficulties breathing, while other people's breathing can be shallow or rapid, like breathing is very fast. And then if you use a stethoscope to check for the auscultation, you find out that the heartbeat is really fast, beating fast, and most people is irregular, while in most people they will find it very hard to even breathe. While some people may experience seizures, some people might become agitated, like they're in a state, they are being tense about everything that's happening, and from that agitation and being tense, they may now convulse and start having seizures. What we talked about in the types of shock, we can from there know the causes of shock. What causes this shock? It is from an accident, those that have these injuries and heavy bleeding. From there, you know that they have an excessive loss of blood. And then in most people, myocardial infarction, which is also known as heart attack, commonly known as heart attack. Yeah, so when the heart is in such state, it is unable to pump sufficient blood around the body. And we have the high BP infections. We already explained that, where infections can build up and release harmful toxins in the body, maybe from a ruptured appendix. If it's ruptured, it will now release those toxins into the body, or skin infection, or urinary tract infection, or pneumonia. So all of those, and also the spinal cord injury. The internal and external bleeding, there can be an internal injury resulting from the accident, and also the external one where that one we can easily see it and you can stop the bleeding. Now, what do we do when we are in such a situation where we are close to a shock patient, if it's home accident or just on the road? What do you do? Well, I'll just be talking about as an untrained person, what should you do when you meet a shock victim? Well, since you don't have much knowledge, the best thing you can do is to keep the person in a comfortable position. If the person is in a tight clothes, just pull off the clothes, like make the person feel comfortable. Don't give any liquid. No matter how thirsty the person may seem or might tell you I'm thirsty, don't give any liquid because it might lead to choking. Yeah, so it's best you avoid giving any liquid orally. Meanwhile, while you're trying to give a CPR, if you know how to administer one, you should have already called an ambulance. Well, yes, ambulance, or you should have already seek medical help, or you should have been on your way to the hospital already. Then you administer the CPR. Before administering the CPR, you check for ABC, the airway, the breathing, the circulation. That is the airway. You check if there's anything obstructing the throat, Then the breathing, you check if the person has any issues or problem breathing. And then the circulation, you check if the blood supply is quite okay. How do you check this? From the skin, you check the pulse. The pulse, you can just feel it here. If you bend your hand, you can feel someone's heartbeat from here, the radial pulse. So, see you guys in my next video.